All right, good afternoon, everyone. Great to be with us on this Thursday, June 10th. It's 2 o'clock, so let's go ahead and get our briefing started. Today, we'll hear from Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley. We'll hear from Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management. We'll also hear from Darren Rausch, Health Officer and Director of the Greenfield Health Department, and Lorraine Latham, President of Jump at the Sun Consultants. A quick reminder, if you're not one of our speakers, please keep yourself on mute. Okay, let's go ahead and get started with Mayor Barrett.
Thank you very much, Kimberly, and good afternoon, everyone. I'd like to begin my remarks with an update on this week's gating metrics. And we've got good news. We continue to have good news to report. And I think everybody should acknowledge the progress that we're making. But we remain in the moderate transmission category for the rate of COVID-19 cases per 100,000. We are down from 26.8 last week to 18.8 this week. This continues to be the lowest disease burden rate we have seen since March 2020. And I am very, very pleased to see our numbers continue to decrease each week. Equally important, if not more importantly, we also remain in the low transmission rate for percent positivity. And this is a number that I look at very, very closely. We are down from 2.2% last week to 1.8% this week. And the fact that we are in the 1 to 2% range is phenomenal when you think where we were 2 months, 3 months, 5 months, 6 months ago. So we continue to make great progress. And it is almost exclusively because we've had so many people who have really complied with our advice, our rules, and have gotten vaccinated. But we're continuing to see our vaccination rate increase for those 16 and over who have completed their vaccination series. We're up from 42.9% last week to 44% this week. That number I'm not as pleased with. I want that number to go higher. And I think it's important for us to continue to push to have that number go higher. I will say that 50.7% of those 16 and over have now completed at least one dose. But again, that number in my mind is still too low. We can do more. More individuals, I hope, can see the incredible success that we have had because people have gotten vaccinated. And I think it may be for those who haven't gotten vaccinated, they may be thinking, oh, the rates are low now, I don't have to worry about it. Well, the problem is you can still spread it if you get it. You can still get sick if you get it. You can still die if you get it. And we want to make sure that we are doing everything as a community. And I was talking to someone yesterday who talked about the patriotism involved in getting the vaccination, that it's actually a patriotic act to get this vaccination. And I totally agree with that sentiment. In terms of getting life back to normal, we remain on track to have our city offices reopen on Monday, June 21st. That's just a week and a half away. But based on the disease numbers, I'm feeling more and more comfortable with our reopening decision. We are requiring everyone in the public areas to continue to wear masks, which is an additional precaution that offers added protection from disease spread. We are getting closer to return to normal. And again, the best way to reach that goal fully is for more people to get vaccinated. So what do we do? Where do you go? Well, fortunately, we're going to continue to do the work we are reaching into the community. I'm a basketball fan, so I've been watching the Bucks. Haven't been happy with the first two games in this series, but I've been impressed by how many people are outside the Fiserv Forum watching the game from that plaza. And so working with the health department and our fire department, we thought we're going to bring vaccinations there. And the Bucks have been a great partner, which is no surprise. So the Milwaukee Health Department is partnering with the Bucks and the fire department tonight from 5:30 to 7:30 to bring vaccines to the plaza at Fiserv Forum. So we will have available tonight, 5:30 to 7:30, vaccines at the plaza at Fiserv Forum. Then you can sit around and watch the game. You can visit the MFD medical tent located on the plaza in front of the Punch Bowl Social. So what do you get out of it? What do you get out of it? Well, hopefully we're going to get a Bucks win out of it tonight. We need that. But those who receive a vaccine will be eligible to enter into a raffle for 2 free tickets to the Bucks 2 p.m. playoff game on Sunday, June 13th. This is a pretty amazing offer because this is an opportunity to see the Bucks in the playoff game against this very tough Brooklyn team. But again, you're eligible to be entered into a raffle for 2 free tickets to the Bucks 2 p.m. playoff game on Sunday, June 13th. The winner will be identified and notified the following day. Obviously, not the following day after the game, the following day tomorrow. For this weekend, we're continuing to have pop-up sites that will be available on Saturday from 10 a.m. to 2 p.m. at the Milwaukee Consortium for Hmong Health, located at 1445 North 24th Street. That's basically 24th near Valete Street. At 10 a.m. to 2 p.m. at Community Baptist Church of Greater Milwaukee, located at 2249 North Sherman Boulevard. That's essentially close to North Avenue and Sherman Boulevard. And Northwest Catholic Schools, 1:30 to 3:30 p.m. at 7140 North 41st Street, up near Good Hope Road, the old Good Hope School. So I'm sorry, Our Lady of Good Hope. So this is a chance, again, for people to get vaccinations in the community. On Saturday, we'll be at noon, from 10 a.m. to noon at the New Direction Christian Church, located at 2127 West Garfield. From 10 a.m. to noon at St. Raphael School, located at 2075 South 32nd Street. And from 1:30 to 3 p.m. at Kingdom Faith Fellowship Church, located at 4200 North Holton Avenue. In addition, I want to remind the public that our MPS vaccination clinics will sunset this Friday for the obvious reason that school's out for summer. And the teachers can be happy, the students can be happy, and maybe even some of the parents will be happy with that. But school's out for summer this weekend, so we will be closing those MPS vaccination clinics. We will also, though, we'll continue to have hours at our Northwest and Southside Health Center vaccination clinics. They will have new hours from noon to 6 p.m. Starting Tuesday, June 15th. On the testing front, I want to share that tomorrow, June 11th, will be the last day of the downtown shuttle to the American Family Field testing site. Again, the downtown shuttle will end. We still have the testing, but the shuttle will end. And that's been a great partnership as well. So the partnerships continue. And one of our strongest partnerships has been with the county. And with that, I'm going to turn it over to County Executive David Crowley and thank him once again for his partnership.
Well, thank you so much, Mayor Barron. We definitely appreciate your partnership as well. And so good afternoon, everybody. Thank you for joining us. I would like to start off with some encouraging statistics regarding the spread of COVID-19. So new case totals in the United States have dropped to under 30,000 per day in recent weeks, marking the lowest number in the country literally since June of 2020. So these numbers reflect that approximately 8 cases per 100,000 people each day. And for comparison, during the most recent peak in April, that number was closer to 22 cases per 100,000 people each day. And so this decline remained steady even after the CDC's recent guidance that masks were no longer needed for vaccinated people in most circumstances. And right here in Milwaukee County, we will continue our vaccine efforts and mobilization of the vaccine to keep this downward trend going. And we will be working with the health department to shift our focus towards pop-up clinics across the county in communities of need. And so this change will promote greater accessibility to those who have not yet been vaccinated due to barriers such as like transportation, work, or just not having time. But additionally, we will continue our Healthy Homes initiative, bringing the vaccine to those who experience difficulty leaving their houses. So as a reminder to those who want to get vaccinated or know someone who needs to get vaccinated and is stuck at home, and you are interested in learning more, please visit healthymke.com/healthyhomes to get more information. And over the past year, COVID-19 has literally wreaked havoc on our lives, on our businesses, and many essential programs throughout our communities. And a recent state budget cut could make some of our recovery right here in Milwaukee County even tougher. The cuts that I'm talking about affects our Milwaukee County Transit. And we know that many residents rely on our public transportation to get to work and go about their daily lives and access vaccinations. And we are working diligently to repair our transit system from the impact of revenue declines due to COVID-19, as well as the budget cuts from the state. And so just this morning, I was at the East-West Bus Rapid Transit groundbreaking ceremony, or BRT groundbreaking ceremony, celebrating this first of its kind undertaking in the state. And this BRT is a BFD because it's a one-of-a-kind thing happening in the state. This is a first. And so this is going to allow for more connections between major employment, education, and recreational destinations throughout the county. And honestly, this is an investment in equity that's going to help us provide more efficient, higher frequency services for people who don't have vehicles or families who only have one vehicle. or people without a license, or residents with a disability, or a host of others who continuously rely on our public transit system to navigate throughout Milwaukee County. And this is an important reminder of the critical role transit systems play at a time when our region is really attempting to reopen safely right now. And this is a critical moment in our recovery where residents are relying on public transit to safely return to work and contribute to our economic recovery. And so this is not the time to make drastic cuts to our Milwaukee County transit system as we work through the state again and through our local budgets this year. And so a major cut in transit funding means, again, major reduction in transit services. And when we reduce our transit services, this can make life incredibly difficult for people who rely on our buses. And so not to mention that to see this kind of transformational change we all want to see in our region through more connected communities, more residents working good paying jobs in every corner of the county, and the stimulation of one of the most important drivers of the Wisconsin economy. In order to do that, we desperately need to fund local transportation services and connecting workers to jobs, businesses to customers, and residents to healthcare services. These are key parts of how we'll fully recover from this pandemic. And so we all must do what we can to keep transit services funded and reliable for those who need it. And so thank you for this time. And with that, I'll hand it over to Dr. Weston. Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First, to our numbers, we are currently seeing in Milwaukee County an average of 19 new cases a day, and we're seeing about 1 death every 2 days. We continue to see improvements as well in percent positivity at 1.5% and hospitalization now at 30. On a less promising note, we saw vaccinations once again decrease now to about 1,000 individuals getting first doses of the vaccine each day. Now, today I wanted to address a topic that's seen a lot of variability in practice and implementation over the last few weeks, and that is usage of masks in schools and now moving forward into summer programs. So while some have maintained safety precautions, we've seen a number of school systems and recreation departments modify their policies on childhood masking. In many cases, changing masking from required to encouraged. Now, to be clear, masking is less critical for protection in the outdoor, open air environment where transmission of disease is far less likely. In the indoor setting, however, of summer school, indoor summer recreational activities, and other summer programs, masking among children remains an important issue. Now, I've often heard school or municipalities and school districts citing the change in CDC guidelines around masking as a reason for the modification of policies. And while perhaps well-intentioned, this is a misunderstanding of CDC guidance. So a few facts are important here. Fact number one, not a single child under the age of 12 has been vaccinated against COVID-19. Fact number two, while acute disease is mild in children, long-term effects of this virus on a child's lung capacity, heart function, immune system, these are largely unknown. And based on the history of other viruses and understanding of COVID-19, it's far more likely that a child would have detrimental long-term effects from the virus than from any future authorized vaccine for those age groups. Fact number three, cloth masks are effective when everyone who is unvaccinated in an indoor environment is wearing them, and are in fact more protective of those around the wearer than the person wearing it themselves. Therefore, saying that if a kid is concerned about COVID, they can wear a mask while other children don't have to is an ineffective and ultimately misguided strategy. Fact number four, we now have the Delta strain of COVID-19. This is the one that caused so much illness and death in India, and it's beginning to circulate more and more widely in the United States. And this is far more contagious than the previous UK strain, and certainly far more than the previous strains in the United States. Fact five, among childhood age groups in Milwaukee County right now, the elementary school age group of 5 to 11-year-olds has more than twice the positivity rate as compared to our general population in the county. And in fact, children in our community currently have a higher positivity rate than any other age group. And finally, fact number six, the CDC, based on those previous facts, recommends universal, that's their word, universal use of masks for children. The change in CDC guidance around masks was for vaccinated individuals, not for children under 12 who are not yet able to be vaccinated. We as a community and as a country are so close to the point where anyone of any age who wants to get a vaccine can get one. But until that day comes, we must continue to protect those who are unable to get vaccinated, chief among them are children. Although acute illness is typically benign in children, this is a new virus, and there are many unknowns. As we discover more and more long-term effects on adults, lung damage, blood clots, chronic fatigue, even early death, we don't yet know how the virus may affect children in the future. Once the vaccine is available to them in the probably late summer, early fall, this discussion will change. Everyone will have the opportunity at that point to be protected and can make individual decisions as to their own risk tolerance. But for now, let us work to continue to follow the carefully considered, evidence-based expert CDC guidelines and continue to protect our children with the simple, non-invasive practice of masking while in indoor group settings. Thank you very much. Stay safe, and I'll hand it to Health Officer Darren Roush.
Thank you very much, Dr. Weston. It's my pleasure to join today. And as everybody has said before me, we have seen some very, very positive developments in the last couple weeks in case trends, and we're certainly also seeing those in vaccination. We note in our data report this week, and I'll show you the data and the graphs soon, that we continue to see decreases to plateaus in the data throughout Milwaukee County, both in the city and in the suburban communities. And we see those rates continuing to decrease amongst kids and older adults as well. As mentioned previously, vaccination efforts continue countywide, including the newest group that is now eligible, the 12 to 15-year-olds. And I'm happy to report that in just about a month of eligibility, the percent of 12 to 15-year-olds who've received their first vaccination is well over 20%. And for this week, for the first time, we reflect that about 5% of 12 to 15-year-olds have finished their vaccine series. So we're seeing some pretty good uptake in those populations as well as others. Certainly we want to see our rates countywide go up, but we continue to see about a 1% increase for initiation of the vaccine series and completion of the vaccine series each and every week, both here in Milwaukee County and statewide. So with that, let me go ahead and share the data for this week so you can get a picture of what's happening. Here on the screen before you, we're looking at new cases of COVID-19, and you can definitely see for the last 5 weeks, we have seen marked decreases from the little peak that we saw back in April. So for 5 continuous weeks, we're seeing decreases in the city of Milwaukee. For maybe about 6 or 7 weeks, we're seeing decreases in those 7-day averages for the suburban communities. But overall, we're seeing some very positive data improvement. When we look at the kids report that I just switched to here, again, kids were kind of driving some of those increases in cases back in April. And again, we see demonstrated decreases in the kid populations as well. But this is something that we want to watch carefully. As Dr. Weston mentioned so eloquently just moments ago, kids continue to be vulnerable, especially those under the age of 12, because they are not eligible for vaccine yet. So keeping our kids safe through the use of masks is very important. So switching back to our whole county report, cases are on the decrease. I'm happy to report that deaths are down as well. We're only reflecting 1 death in Milwaukee County over the last 2-week period. So that's a very positive finding and certainly aligns with high levels of vaccination in our more vulnerable populations. We have focused on the reproductive number in the past, or that transmission rate, and I'm happy to report that those transmission rates for both the county, the city, and the suburbs are some of the lowest we've seen, or are the lowest we've seen throughout the pandemic. We see that transmission number as 0.61 for the suburbs, and it's about 0.64 for the city. So we're seeing very similar patterns across both communities. We know that testing has been something that we've been watching carefully. Essentially, we're seeing a very flat trend in our percent positivity, which is very good over the last 2 weeks. And we're seeing testing that's very consistent over the last couple weeks. Again, testing capacity exists, and there are people with symptoms that need to be tested. And certainly we want to continue to encourage people to get tested as needed. Lastly, today, I'll show the spatial map just to show where the cases have occurred over the last couple weeks. And when we look at this map, looking at the last 2 weeks of data, we continue to see some of the same patterns that we've seen in the past. The highest rate of cases have tended to be in the northern suburbs, Brown Deer area, Glendale, as well as the northwest side of Milwaukee County, but certainly there are some pockets of activity in orange and red in other parts of the county. Now, I just want to share the vaccine report briefly as well, because there's, again, continued improvement in our vaccinations. The first graph here continues to show both first dose in light blue and completion of the series in dark blue. And we can continue to see increases to our cumulative number of residents who've either started their series or completed their series, which is very, very good news. When we look at this as a trend over time, we see that we peaked in terms of giving vaccines back in March and April, but certainly there is vaccinations occurring on a daily basis, about 2,000 vaccines daily countywide as our 7-day average. And again, Mayor Barrett and others on this briefing today talked about several opportunities to get vaccinated in the coming days and weeks. So certainly want to make sure that everybody out there is pushing vaccination and getting vaccination as they have time and availability. We've also tracked age groups, and again, how those age groups have been vaccinated. And this line right down here is an important line to focus on. This is the 12 to 15-year-old age group. Again, they became eligible back in early May, and you can see that, you know, they're approaching about 22% completion for first dose. And when we scroll down in this report, this is where we see that about 5 or a little over 5% of those 12 to 15-year-olds have completed their vaccination series. So again, the trends here in vaccination is we tend to see higher vaccination rates in our older, more vulnerable populations, but certainly each of those age groups continues to increase slowly as they have over the last several weeks. When we look at the vaccination data by race and ethnicity, again, we see very high rates of vaccination in our white and Asian populations, and lesser so in the Hispanic or Latinx and Black or African American. Again, these trends continue to climb slowly, but certainly we see disparities across race and ethnicity with showing the first dose or of receiving the first dose of vaccine. But we also see those same trends when we look at completed vaccination series, and those disparities continue to exist, although we're seeing some increases across all of those groups. I want to end today just to kind of highlight some of the things you've already heard. While disease for COVID-19 is lower than it has been over the last 15 months of the pandemic, there still is a risk. We continue to see cases throughout the community, in workplaces, in schools. Just this week in my community, we investigated a case that attended a high school graduation, was in fact one of the graduates. And so disease is still occurring. Obviously, as Dr. Weston has mentioned, risk is more significant if you haven't been vaccinated or if you're not eligible for vaccination. So adults who haven't been vaccinated are certainly at risk. And we know the youngest kids under the age of 12 are at risk by the very nature of the fact that they cannot get vaccinated yet. We know that recent data continues to support that the large majority of cases continue to be in those individuals who are unvaccinated or unable to be vaccinated. And we, again, want to continue to remind people that vaccinations are available at many places throughout the city of Milwaukee, the suburban communities, and the county. Both health departments, clinics, pharmacies, and many, many other organizations have vaccine for you or for your loved one. And lastly, I want to remind you to continue to be a champion. Your story may be able to influence others to get their vaccination. I've told the story about my son numerous times. Didn't listen to me, but certainly listened to his 14-year-old friend. And I'm happy to report that my younger son will be coming in for his second dose today. So again, your personal story and your narrative may be a positive motivator for others. So please be willing to share that. It'll be very important to continue to increase vaccination rates in our community throughout the summer to really get ahead of this pandemic and keep our case rates low. With that, thank you very much for your time and attention, and I'll now turn the briefing over to Lorraine Lathan from Jump at the Sun Consultants. Lorraine?
Thank you so much. If you could share host with me so I can show my PowerPoint, that would be great. I'm going to be brief.
You should be able to share right away.
Got it. I got it. Thank you so much. Okay, let's see. 1 second. Okay, here we go. So I just wanted to share with you, my name again is Lorraine Lathan. I'm from Jump at the Sun Consultants. We've been in business for about 15 years now, and our focus is on helping to address health disparities. We have been very much involved in the effort to make sure that everyone who wants to get vaccinated has that opportunity and that they're educated and informed so that they can make decisions that fit within their values and beliefs. As it relates to the UEOC and the work that we've done, we actually conducted focus group research that helped to identify the messaging of this particular campaign, the Authentic Voices campaign. And we also provide information on the weekly updates that are shared as key messages out into the community. So today I'm going to talk about our role as it relates to the community mobilizers in terms of our role in designing, training, and deploying community mobilizers. And it's driven by really trying to work with that group of folks that have been defined as the movable middle, undecided, hesitant, the wait and see group. So if you look at this data, and it pretty much matches with what others have already mentioned in terms of African American and Hispanic, we're seeing this is national data that looks very similar to what we're seeing in Milwaukee City and County data, that there is that group. There's 22% of African Americans are saying, well, I'm going to wait and see. I'm not quite yet sure. And we're also starting to hear this with this same population who they as adults have been vaccinated, but they're waiting to see about their kids. They're not quite sure if they want to take that step yet. Some of the things that this wait and see group again is incentives. Mayor Barrett talked about free tickets to sporting events. I believe the Brewers also gave out tickets as well. And so these are some of the things that we're exploring. We are hearing that just in terms of having transportation, that has been an issue. But we also realize that it's nice to give incentives, but just having that conversation with someone who has had a shared life experiences, who has been vaccinated, that sometimes is the key to getting people out to get vaccinated. And so these are our community mobilizers. We see them as trusted educators in the community. Who are they? They are very diverse in terms of racially and ethnically diverse. They're from a number of the vulnerable zip codes that we're working in. They're paid, they're volunteers. We're very helpful, we're very pleased with Alverno College School of Nursing. We have 40 volunteers that go out with community members during door-to-door canvassing. The type of support that we provide is information that was developed by Healthy MKE that is shared. This is an example of a door knocker. If people are not at home, we leave that information so that they can, again, get medically accurate information. But more importantly, when they have those conversations, we hear people saying, yes, I'm going to get it done. Or even we're giving information on where the pop-up clinics are in their neighborhood. And we do this in a very non-judgmental way. Um, we just want people to have the information so that they can make those decisions. Additional support that we provide is just the whole logistics around deploying community mobilizers. I'll speak a little bit on that. We provide them with weekly updates, and then we also support them with data entry. In terms of deployment, we've targeted 15 zip codes, and again, thank you, Dr. Weston. We've used his EVE model to focus on 15 zip codes where we're seeing low vaccination rates with high vulnerability rates. And so we go door to door. We use a texting program where we do peer-to-peer texting in zip codes to say, hey, our community mobilizers are going to be in the neighborhood today, just to let them know that they'll be knocking on their doors. So show them some love and, kind of listen to be prepared to ask any questions that you might have, and also just give them an opportunity to share the information with them. We also do, so that's broadcasting that goes by zip codes, but then we also do peer to peer. So it will go to an individual to let people know where they can get, where the pop-up clinics are occurring, and or that we have community mobilizers in the area. As I mentioned, we're very strategic in terms of how we go door to door. We pair them up with some of the nursing students, and we recruit people in and from the community. So that's pretty much our focus. Yes, that is it in terms of the work that we've done. And I have to also thank Executive Crowley because he certainly has helped, the county has helped to fund this particular initiative. We plan to have anywhere from 40 to 80 mobilizers in the community that go door to door, but also hosting special events, pop-up events as well. So with that said, I think I covered everything. I'm gonna stop sharing because you're gonna see my screen. But thank you, and if there's questions, I am available to respond. Thank you.
All right, Lorraine, thank you so much. At this point, we're going to go ahead and open it up to questions from the media. The first question does come to Dr. Weston. So Dr. Weston, this question is from Joyce Garbasiak with WISN 12, and Joyce asks, can you clarify, has the Delta strain been identified in Milwaukee County?
So I can speak to Wisconsin. That's the data that's most broadly disseminated. And this is public facing data. I believe 13 is the number of cases of the Delta strain that have been identified. Now we have to remember that's a very small percentage of people who test positive where the virus is actually sequenced and checked. So it's likely much higher than that. I would imagine Wisconsin is probably on par with the rest of the country, which is around 6 to 7% of the virus right now is from that Delta strain. And based on that, I think it's likely or quite likely that the Delta strain is in Milwaukee County as well.
Great. Dr. Weston, keep your camera on because I'm going to throw another question your way. This is from Mary Jo Ola with WTMJ. She says, with capacity limits lifted at Fiserv Forum in the Deer District, what concerns do you have, if any, about crowds inside Fiserv? How will health officials monitor everyone?
So the latter part of the question, I would defer to the health department. But as far as thoughts on opening up Fiserv Forum and the Deer District, people can get vaccinated at this point. And so I think if you are vaccinated, if you're fully vaccinated, I think you can judge your own risk tolerance, but I think you can be pretty comfortable going into those sort of atmospheres and knowing that you have the protection from the vaccine. For people who aren't vaccinated, I think you'd probably want to be more hesitant of going into group environments, specifically the indoor group environments. And the answer there is quite simply, get vaccinated. It's easy, it's free, no matter where you get it. And there's sites all over Milwaukee County.
All right. The next question comes from Allison Durr with the Milwaukee Journal Sentinel, and it's for County Executive David Crowley. She asks, Are you able to explain a bit more why cutting state funding for the transit system would be harmful, given how much the county has received in federal funds for transit during the health emergency?
Absolutely. So we really have to look at the long-term picture. So between now and in the next 6 years, 2027, we're facing a total budget gap of between 100 and 150 million dollars a year. So when you keep that context in mind, cutting $40 million in state funding to our Milwaukee County transit system is a massive 2-year cut that already compounds on the pain and we're already in a difficult situation. So it's important to remember that there is a long-term picture for this. And so after the federal dollars are gone, we still have long-term fiscal sustainability issues stemming from the fact that we still have stagnant state funding and controls on local revenue. So the more cuts that we see creates a more instability for us. It could mean that we have to make some tougher decisions down the line. And that's what we want to avoid.
All right. The next question is for Dr. Weston, I believe, and this comes from Sharon Bagenda from CBS 58. And she says, what are the vaccination percentages for the African American and Hispanic populations as of today in Milwaukee County? Would you say it is lower than what you would like it to be?
Sure. So when we look at our white population, we're at about 51% vaccinated. Hispanic is about 36% vaccinated, and African American is 26% vaccinated. And as far as whether the numbers are where I'd like them to be, I mean, across the board, I'd love to see the numbers higher. I'd love to see 100% vaccination rates throughout the county, but certainly we have more work to do in our communities of color, and there's a lot of initiatives going on that front, but across the board, we have many, many more people who can come out and get vaccinated, and I hope will in the near future.
And Darren Roush may be able to weigh in on the next question here. Can you talk about some of the vaccination efforts the city is working on to better reach communities of color? And how important are trusted voices within communities of color when it comes to convincing people to roll up their sleeves?
Yeah, that's a great question. I think trusted sources and trusted messengers is probably a key to all of this. I've shared the story about my son, and, it's just a situation of you trust the people you know. And certainly, I think in the minority communities, that's certainly very, very important. I can't speak for everything the City of Milwaukee Health Department's doing, but certainly I know they've been out and have done a number of events in and around the community. In suburban communities, we've gone to farmers markets, we've gone to events, we've set up pop-ups. So there's been a lot of opportunities where we've taken vaccine out into the community at a place that necessarily wouldn't have vaccine otherwise. And again, I continue to remind everybody that there are vaccinations available at other sites outside of health departments and clinics. Pharmacies, some of the nonprofits, some other community organizations are certainly sources of vaccination as well.
The next question comes from Mike Spalding with WTMJ AM. And Darren, you may be able to answer this question. Dr. Weston, your name is on this as well. So the question is, the DHS says 30 to 40,000 doses of the J&J vaccine are at risk of going bad at the end of the month. How does Milwaukee County fare when it comes to its vaccine numbers? And is there a concern of vaccines going to waste?
Yeah, I have not seen or heard the numbers from the Department of Health Services, so that number is a little bit surprising to me in terms of its size. But what I can say is that we prepared for a long, drawn-out vaccination campaign. We had doses in our refrigerator to continue high levels of vaccination throughout the month of May and June. And quite frankly, in early May, right after the 12 to 15-year-olds became eligible, there was a precipitous drop in the number of vaccines given on a weekly basis. So certainly many of us have had large numbers of vaccinations. Many of us have worked with partners to redistribute. I can't speak to the entirety of what's happening in Milwaukee County, but I can say here in the Greenfield Health Department, we probably have about 200 doses of J&J vaccine that will be expiring in the next several weeks. And we have exhausted all options of trying to get rid of those doses and trying to get those doses to other partners who need vaccines. It's really just an unfortunate situation that we're flush with vaccine now, and many of the other vaccinators are not looking to take on vaccines. So unfortunately, we will have some wastage here, but we continue to give it. If somebody comes in this afternoon to the health department, we'd love to give them a vaccine.
I would just echo those comments. I think that was perfectly said. The only thing I would add is just branching off of that. We've worried a lot in the past, months ago, about waste. And I think certainly every vaccinator is still conscientious and worrying about waste. But I think the strategy at the state level, at the local level has shifted. And the goal now is certainly not to waste any vaccine, but I think most importantly, never to waste an opportunity to get somebody vaccinated, to get somebody protected.
Right. The next question comes from Madeline Anderson with Fox 6, and she asks, do you have information on people in the area who are hospitalized with COVID-19 and or have died from COVID-19 recently? Were they unvaccinated, and were any of them vaccinated?
So it is challenging to pull together the data from the Wisconsin Immune Registry database on vaccinations and the database, the WEDS database on disease. We are working on ways to link those up to better understand who's getting sick, of who's vaccinated and who's not. Now, that said, there's a couple things that we do know that can give us a very good estimate on what the situation is there. And so one thing we know is that the vaccine, whether it's Johnson & Johnson, whether it's Pfizer, whether it's Moderna, provides just about 100% protection from severe illness, from hospitalization, and from death. And so we know about that 100% or near 100% protection. The other thing we know is looking at large scale studies. So one was in Ohio, and in Ohio, they saw that since January of 2021, over the last 6 months, 99.75% of people who were hospitalized in the entire state were unvaccinated people. And so I think based on that, we can very well conclude that in Milwaukee County, most likely just about 100% of the people who are getting hospitalized with COVID are unvaccinated. And we can presume that just about 100% of the people who've died with COVID in Milwaukee County are unvaccinated.
You know, Lorraine put a message in the chat box that I would love to have her come on and expand upon. And you're referring also to the J&J vaccine and building confidence. You chatted to everyone. We're trying to rebuild confidence regarding the J&J vaccine in communities of color. I wonder if you could expand on that a little bit.
Certainly. I'm also a member of St. Mark AME Church, and the Quality of Life Center was provided J&J vaccines. That was the only vaccine that we provided. And we provided it because of issues of non-compliance with people coming back for the second dose. And that it's some of, our community is transient. So we were really confident in it. And I have to tell you, when it was pulled, a lot of us lost many nights of sleep. We had to call people, we had to explain, to just check on them. And it's the credibility of the church, the neighborhood, the community, everybody who was involved. So it's really been taking time for us. Now we will be offering J&J as well as Pfizer. We won't just be offering the J&J, but the issue is that there was a lot of work just to build the confidence. We are also a testing site for COVID as well. So people were coming and getting their COVID tests. So then naturally they said, okay, we're going to also get vaccinated there. And so I just want to share with you, as we've been going door to door, we've been asking people, who are undecided, if in fact, or they're leaning towards getting vaccinated, which vaccine would they consider? And, some people are saying absolutely no to J&J, and others are kind of agreeing to it. So it's just kind of, we felt like we made a lot of progress, and now we're having to kind of rebuild some of that progress, because there is this perception that J&J was, again, kind of identified specifically for low income communities of color. Some people have that perception. So that's why I'm trying to explain why it's so important to have community mobilizers to go door to door and have frank, open, honest conversations with people so that they can make decisions that they feel comfortable making as it relates to the vaccines.
Lorraine, thanks for that context. Dr. Weston, the next question is coming to you from Joyce Garbasiak with WISN 12. And she says, are recreation departments that don't require masks for indoor summer activities acting irresponsibly? What advice do you have for parents in light of the mask optional policy that many rec departments are now adopting?
Well, listen, I think all of us are trying to do what is best for our children, our families, our communities. However, in trying to do what is best, the facts are the facts. They're clear. Our young children are not vaccinated. Complications of COVID in young children are just unknown at this point. And universal masking among children is the safe practice until our children are able to be vaccinated. And the CDC guidelines are evidence-based, they're expert-derived, and they're very clear. And they outline these practices for schools, for rec departments, for summer schools to follow to keep their communities and keep their children safe.
All right, I believe that was the last question. So any other questions from the media? Okay, if not, we really appreciate everybody's time. Thank you very much, the county executive, the mayor, to Dr. Weston, to Darren, to Lorraine for your time and all of your information. And we look forward to seeing everyone back here next Tuesday. Thanks, everyone.
Thank you.
Thanks, everybody.
Thank you.